So here we're going to talk about how we diagnose and detect for scoliosis. Okay, so I'm going to start with this particular one of our physios here called Marlon. Marlon, I'm going to have you turn with your back towards me here. So turn around. Okay. I'm going to check to see in terms of the shoulder leveling where he has a higher shoulder or another. Okay. So right here, he's higher here on his right shoulder. And also, too, when I go with my hand to his back, he definitely has some curvature here in his thoracic spine. So we talked about the thoracic curvature, the scoliosis. He definitely has that, especially between his shoulder blades. So when you go down to his hips, his hip level, we find that his left hip is higher than his right hip. Okay? So I'm going to have you now turn and face the wall this way here. Okay? So if you were to look, based on what I saw, his right shoulder is higher here, okay? And if you were to look for, they call the abnormal curve S shape or C shape in the spine, you tend to obviously, I normally use my hands and follow the curvature, and he has a bend right there. Not much, but I can definitely feel that into his back over here. And then when you go into the level of his lower back, he definitely has what they call an increased curvature from the front to back in terms of the curvature called the lordosis here. And when you go into his lower back here, we go to the level of the hips, you can definitely see he's higher on his left hip there. Okay? That's the physical examination that any parent or any of our physiotherapists or even chiropractors normally do with determining whether a client has scoliosis and where it is. The second thing I'm going to obviously talk about is doing a sign called the Adams test.